Welcome to Black Health Matters. I'm your host, Daryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
Teeth left. Some have all their teeth left. So uh, dental health is an important part of our health, just as is mental health and all other aspects of the body. But we tend not to talk too much about it. But that's an area that we're going to have a little more focus on in the future because it's the source of infections for the heart and other body parts as well. So I just keep this article that talks about how to brush your teeth with the fluoride toothpaste and to floss and there are many ways of flossing and many ways of brushing your teeth, whether it's by electric or by hand or flossing by water or by hand. And they say that the most important part of the process is the mechanical part of putting the fluoride on your teeth. And um, the least important part of the process is perhaps the mouthwash, which they caution against washing off all of the fluoride, which really prevents the cavities. But cavities are the commonest problem with teeth. And the advice is to see the dentist at least once every year or two, just as the same advice for seeing the eye doctor. Except the eye doctors every 2 years. So just calling your attention to the fact that oral care is an important part of our health. Mr. Buchanan.
Yes, good morning, everyone. I just watched a TV show with this young genius who memorized everything about all the presidents. And she said, I think it was President Harrison. When he died, he only had two teeth left, two natural teeth.
Hmm.
And somebody told me much too late in life, he said, only floss the teeth you want to keep.
I
I
like
wish I heard that a long time ago.
that. Yeah, okay. Well, that's an important aspect of it is uh, when you get beyond 60, you find that many of your friends, associates, and maybe you yourself will not have as many of your teeth as you had when you were 40. So,
I have a question.
yes.
Recently, I heard a report about the danger of fluoride in toothpaste and dental products, and that it has been a recent discovery that fluoride is dangerous to your health over a long period of time. Has anyone else heard that? That was maybe a couple of days ago.
Well, actually, the fluoride has its problems, but its benefits far outweigh its problems, particularly if you only use fluoride for teeth. Now, having fluoride in the water is another issue because that's one of the reasons why people have opposed to having fluoride in the water. But using it in the toothpaste is advised. And yes, there are side effects of everything. So yes, there you can have too much fluoride, but usually, if you only do it, and it's advised to brush your teeth twice a day, and to floss twice a day. Let's see, Betty Blair.
Yes, good morning again. Um, I had my kids young and I lost a lot of my back teeth. So at maybe in 2017 or 18, I decided to go with implants. So now I have a car in my mouth because that's how much it costs me.
That's right. Yeah, yeah, they're expensive. Any other comments about? Oh, Janice, you had your hand up.
Yes. Good morning. I just wanted to share that yesterday I had a dental appointment, and my last appointment, they cautioned me and warned me about pockets in the back and asked me to be more aware of flossing. I floss every night. Sometimes in the morning when you're rushing to get out, we brush our teeth, but we don't take the time at that time to floss. And you can floss at night while you're just looking at TV. And anyway, they said it made a big difference. And just wanted to share that.
Yeah,
Need to floss. I
flossing.
have all my teeth.
Right.
I was losing some. I had something that was hereditary. And the eye teeth I didn't get, or when I lost the baby eye teeth, I didn't get a permanent one. So I have a bridge, actual bridge on both sides because of the eye teeth. But I have two sisters that had the same thing. So we assumed it was hereditary. But it's really important to floss because now I have to get under the bridges. But I just find it easy to do when you're just sitting and relaxing at night. But anyway, the dentist was impressed, said it helped.
Right. So brushing and flossing is recommended at least twice a day.
Mhm.
Uh, Daryl.
Okay, like Dr. Callender says, um, fluoride is recommended widely, it's almost universally, for toothpaste. It helps protect the enamel. The controversy comes with the water supply. Um, Most of the United States water supply is fluoridated, whereas in the rest of the world it's not, particularly in Europe. Um, 98% of European countries choose not to fluoridate their drinking water. So, I mean, that's where the don't get it twisted. Get your fluoride in your toothpaste. Try to avoid it in your drinking water.
Thank you, Daryl. Okay. Any other comments? This is a very important topic.
I had one more comment. Some toothpaste, I think I gave out that app last week called Beat the Microbead. Some toothpaste contain plastic microbeads. So if you want to go to get that app on your phone, you can scan your toothpaste and see if it has plastic microbeads in it. And that'll help the environment as well.
Okay. Thank you very much. Daryl?
Can I just do one
Okay.
follow-up question when you're ready?
Yes, Dr.
No,
Duncan?
I'm learning how to raise my hand. You can continue.
Oh,
Daryl?
yeah. John Buchanan sent me a text message Saturday or Friday recently. Said if you use that microbeads app. So thanks for reminding me, John. And I've been scanning a lot of stuff since that text message. I forgot to scan my toothpaste, but I did scan my dishwashing detergent. I was using Cascade Pods, and it's got microbeads. So I went back to the powdered Cascade, no microbeads. Um, yeah, so I have been using it, John. I've scanned some other stuff, but it's kind of I scanned my Dawn dishwashing detergent, no microbeads. So I was happy about that.
A lot of the beads come in the dermatological things that you use, like your CeraVe and your lotions. Um, uh, what do they call it? Scrubs for your skin. They have a lot of microbeads in it, so check it out.
Okay, so we can start with the articles now. That's interesting because I eat a banana every day when I can. Actually, I was disappointed because the bananas I got today were not edible. But this is a good article. It talks about many ways that you can have bananas. Smoothies is an interesting way. I hadn't heard actually of having it in oatmeal, but or peanut butter either. But uh, it's interesting. Remember, they used to say an apple a day keeps the doctor away. but they're now suggesting bananas as well. Uh, the downside of bananas, of course, is bananas contain potassium. Potassium is good in terms of it lowers the blood pressure. But if you have kidney disease, it also can stop your heart from beating. So that's the a downside of potassium if you have kidney disease. That potassium bananas is not something that you'd want to eat for if you had kidney disease. But other than that, it's a very important fruit, and it's uh, containing potassium is an upside rather than a downside for most everybody else. I don't know how many have had banana smoothies, and I know you may have had banana nut bread and all the varieties and ways in which banana is used as a fruit. Uh, so the bottom line, I guess, is that banana a day is not a bad idea, just like an apple a day. John Buchanan?
Yeah, they said you mentioned that the banana you had was not edible, but they say when the banana spoils like that and gets brown, it's really good in smoothies.
Well, it wasn't because it was brown. It
Oh,
was because I couldn't uh, open the skin. The sweetest bananas I've ever had are the dark bananas. So yes, I think my desire is to have those brownish bananas because they taste the best. But actually, when you talk about the uh, bananas, the bananas that aren't as sweet are thought to be more nutritionally better for you. Daryl.
Yeah, the greener the banana, the less sugar. And
Yes,
so,
sir.
it's not as sweet. But if you're having blood sugar problems, tend to go with the green ones. And the the greener they are, the harder they are to open. So you may have to
Yeah.
take a knife and slice the top vertically to get so that you can peel it easy.
Yeah, that's the problem I was having. Yeah. Yeah. Thank you, Daryl.
I use scissors.
Yeah.
Uh, One time, John Buchanan, I thought you said that the um, the inside of the skin of the banana was good for you.
Yes, it's yes, because it's good for your bowel movements. It's that's the aspect of it that doesn't taste that good, but it's bulk and it's
Fiber. It's got a lot of fiber.
that's right. Yeah.
Okay, well, I'm going to start scraping the inside skin.
Well, if it's up to you if you like it.
Yeah,
I
well,
don't particularly like it.
I like the bowel movement part that you mentioned. So,
Okay. Okay. Let's go to the next one. This is a
Speaking of
good
bowel movement,
article that talks about the importance of your bowel movements. I think Darrell had discussed this a couple of months ago, maybe even longer than that, talking about how often do you need to have a bowel movement. And uh, what this article is saying is that people who have bowel movements at least once or twice a day probably have the best intestinal flora. Those that have bowel movements less than 5 times a week uh, are less likely to have the best flora. So I guess the goal is to have at least one bowel movement a day. Although if you have two bowel movements a day, that's even better. Any comments about this? Is something that we need to keep in mind. The more bulk we have, the more bowel movements we have, for the most part, is good. Now, if you have more than two bowel movements a day, it's suggested that that may lead to may be the result of you having intestinal diseases. But uh, there's a reflex that we call the gastrocolic reflex that comes into play every time you eat. So that if you had a bowel movement 3 times a day, that would be okay too. It's just that most of us don't have a bowel movement every time we eat, so that twice a day is probably more common than others. Any comments about that? Because Darryl,
Yeah, fiber and water, good combinations to stay regular. Fiber is really prevalent in whole foods, fruit, dark greens. With getting enough water during the day, that'll help keep you regular.
that's exactly what this article goes on to say. Yes. Thank you, Darryl.
I'm
John
sorry.
Taylor?
I'm sorry, Dr. Callender. I was trying to do the hand, but it didn't work out. I just wanted to say something too. One thing about our family group sessions, we talk about everything. And it's not a time that I listen in that I don't walk away with several things that stick with me and I share with family. And I'm going to try to get more family to sit in on it. Recently, I was having an issue somewhat related to this, and I had to go for therapy. And it's like, it was called biotherapy. I think that was the name of it. And you actually go for like physical therapy. And one thing I learned during the session was a small thing that can help with frequent bowel movements is to get a squatty potty. Have you ever heard of that?
I've heard of it, but
Yeah, I don't know if some of us online have heard of it or not. I didn't at the time. And it's a squatty potty. And you sit on the toilet and your feet are raised on this little stand. It looks like a stand, a plastic thing, but when you sit, you're open, you're relaxed. And the person who was doing the therapy with me, she's from India. We squat. You don't do it here, but there's something called the squatty potty, and it's just for your feet to raise your feet. Or if you're sitting on the pot, or excuse me, the toilet, raise your toes. It helps to eliminate everything. Um, I'm fortunate to say, yes, I do have one every morning, and I use my squatty potty. So
thank you for sharing.
something to think about.
Thank you for sharing.
Mhm.
John Tatum next.
Yeah, I had two comments. One was that we had a gastroenterologist on our session one time, and she recommended a little foot stool in front of your toilet.
Mhm.
Put your feet up higher. And so my Dr. Tatum went out and bought one for every toilet in our house.
And that's what it is. It's called a
Yeah,
squatty potty. You're
right.
on your toilet, but basically you're just raising your feet.
Yeah, you put it right in front of your toilet to
Mhm.
raise your feet, because she was telling us that that was the best position for elimination.
Right.
And my other comment is to Dr. Callender. Um, when you eat a meal, um, what bowel movement can you relate to? In other words, how long after you eat uh, does that movement come? I mean, is it
It
related?
depends. It varies from person to person. Some people will have that reflex within minutes and some hours, and some don't have it at all. Uh, Dr. Duncan is next, and then Darrell Armstead.
Yes, sir. My question is about the regular irregularity versus the regularity. Irritable bowel syndrome. Can you tell me the difference and when that's the point that should be of concern?
Can't understand your question. Could you
Um,
repeat it?
yes, talking about the frequency or the infrequency of bowel movements.
Yes.
There's something that someone told me they were suffering from, but they were given the diagnosis of IBS, irritable bowel syndrome.
Yes, that's
Is that
correct.
similar or frequent or unfrequently, or is that an advanced stage of either category?
That is the one condition that is associated with more frequent bowel movements, and it's not a sign of good health, but it's a sign that perhaps the intestinal flora, the good intestinal flora, are less than the bad pathogenic intestinal flora. And yes, IBS is irritable bowel syndrome is a disease entity that is associated with more frequent bowel movements, and it is treated in many different ways.
Okay, thank you.
Daryl?
Yeah, something I learned from being a runner. A lot of my runs were early morning, where I'd go out and run several miles as soon as I got up. But you don't want to be dragging extra weight with you when you're running. And so, like what my habit and what a lot of runners do is get up in the morning. First thing I do is drink a glass of water and eat a banana. And so that kind of triggers the go motion, and it's just a matter of when your body gets in the habit of going at a certain time with certain triggers, it just becomes automatic, and you can go real quickly, and then I'm out for a run. If you want to buy a squatty potty, they sell them on Amazon for around $22. The plastic varieties, you can get wood squatty potties for as much as 38 or $40. Um, but you can go cheap because, especially like if you're traveling, it's hard to pack a squatty potty in your suitcase. So what you can do if you're in a hotel room or on a cruise ship or whatever, there's always a bathroom wastebasket. They're small. You just lay them on on the side, put your feet up on them, and they're perfect.
Thank you for sharing. John Buchanan.
I'm really happy about the response to these two articles. I I'm thinking though that as you get older, your poop schedule changes. I notice that, and I'm serious. I'm talking about 60, 70, 80 years old. There's a difference in the frequency of pooping. So I'm just wondering if anyone else has experienced that.
I have not experienced it. I think a lot of it relates to your diet and the comments that Daryl made about the water and the fiber. I think that has a lot more to do with it than the aging process. So your nutrition may be a part of it. Any other comments to that? Betty Blaylock?
Just listening to what John Buchanan just said, um, my bowel movements are not as frequent probably as they should be, and I realize that one of the reasons is because I do not drink water like I should. So that is one of my goals, to drink more water,
More water and more fiber.
more water and more fiber. So
Yeah.
Any other comments? I don't see any other hands. So
Yeah, my frequency hasn't changed with aging, but I did notice that 25 years ago when I went vegan, that the go became much easier.
Dennis, can't hear you. You're on mute. You're on mute. Can't
One
hear.
of the things that helped me, I was having a problem with that some years ago, and the doctor told me you can somewhat train those movements. First, he had to talk to me to figure out what was going on, and he figured out that I was stressed, my job. Um, at the time, my husband, health issues on a frequent basis, and just pick a time, a convenient time during the day. And for me, and it was during the time that I was working, every morning, you got to have that water. I'm a poor water drinker. I can go several days and not have water. I can have a cup of tea or a glass of juice, but maybe a half a glass of water. But you pick a time during the day that's convenient and sit, read the paper. And then I found out with that squatty potty, it made it easier. So it's just certain techniques you have to find, but I am learning over the years, water is a big part of it.
Thank you very much. We're going to the next one. Next article. This is the human HPV virus, which we've talked about on many occasions, is known to eliminate cervical cancer. And his question is, why don't more people get it? As you know, over the last 20 years, it's been required in school. And we know that this HPV virus, human papillomavirus, is transmitted from men to women. And so it is very important for children to get this virus, and also uh, adults up to the age of 40, which will not only prevent the cervical cancer, but also some of the oral cancers in men. So that this is important to appreciate that human papillomavirus is also responsible for some other cancers, squamous cancers that occur as a consequence of this same virus. So that having the males and the females vaccinated in school is one of the best ways to do it, but you can still get vaccinated up to the age of 40, and it will be helpful. So, because as it identifies in the uh, penile, anal, and throat cancers are occur to both men and women. The cervical cancer, of course, only occurs to women. And often when it occurs to young women who are in their 20s and 30s. And so getting this virus at school age is critical. This vaccine, HPV vaccine, is important. Any other comments? Any of you who've been, many of us on this call are much older and didn't have the opportunity to get the HPV when we were in school because they didn't have it. Dr. Perez.
Yeah, I know I had the opportunity to work with getting parents to vaccinate their young adolescents, early adolescent children with the vaccine. And the move was because they would become sexually active, which a lot of parents didn't want to even deal with. That, the whole thought, and I'm surprised at how well it has gone over, because there was such opposition at the beginning, in terms of incorporating parents and the knowledge that, yes, their children would at some point become sexually active.
Well,
But
you're a pediatrician. What age do they become sexually active? Tell them so people will recognize that with their children.
usually, I did a study that looked at the last 100 years, and the time for first sexual activity between 13 and 15, and many of them before that age. So we're looking at the fact that sexual activity, or the first occurrence, has not changed in 100 years. So early adolescence, young people, old people, it's around the same time. And now we're looking at, with COVID and digital intimacy, so to speak, we're finding that less adolescents, especially less male adolescents, are engaging in sexual activity. So that's a major change. That doesn't have any impact on the use of the vaccine, but our how we look at sexuality has changed drastically. Now, as you all know, in 22 days, I am going to be a grandmother, God willing. And Kobe Bryant kind of coined the phrase "girl dad," right? And building a relationship with sports and activity with girls. as opposed to what tended to occur with boys. And because we are expecting a boy, I'm reading the book Boy Mom. And the whole, with Epstein and sexual abuse, Puffy, all of that about how we sexualize society with males. And what was very interesting about that was that we all know that if you have a male who had a, well, let me say it better. Girls are stronger fetuses than boys. And we found that it is more important because of that fragileness of males, that we spend more time culturing, nurturing boys than girls, both for neurologic development and for dealing with their sensitivity to nurturing. Do you follow me?
Well, thank you for sharing that information. One of the things that I think used to bother me more than anything else was to see these young women in the ages of 20 to 30 dying from cervical cancers. And so getting this vaccine at an early age to prevent those young women from dying from HPV and cervical cancer becomes something that is very important to be aware of. Any other comments about the vaccine and cervical cancer? And we appreciate Lucy sharing the importance of nurturing our males. Because, we have a problem in this country that I'm not sure that people are aware of. For example, in my opinion, there's an effort at killing off all Black males. And I think when we look at what Trump is doing with education, that's going to affect more Black males than anything else. One of the things I've recognized in my career is that when I first started teaching about all things, medicine and other things, the majority of the people who made up the audience were males. Now, when I give talks, about 70 to 80% of the audience are women. And so while we may not be aware of it, our Black men are becoming less and less educated and less capable of surviving because they are that nurturing issue that she's talking about, because of that frailty, they're becoming more involved with groups and groups that are not educated. And so our ability for the Black ethnic group to survive is imperiled because they're attacking our Black men. John Buchanan.
Yes, is the HPV vaccine a single dose now?
In my recollection, it was 2 doses.
2 doses. Okay. Thank you.
Okay. Any other comments before we move on to the next article? Why women live longer than men. And this has been an interesting discussion about the X chromosome and the XY chromosome. And the issue of the extra chromosome is as important as the issue that estrogen may well be the factor. And it'd be interesting to hear what Dr. Perez says about this. But there have been many discussions about why it is that women live 5 to 10 years longer than men. And So we're guessing at it. We don't really know, but we're thinking that it's the extra X chromosome, but it may well be what that extra chromosome is linked to over time in terms of the estrogen testosterone differences. John Tatum.
Yeah, we have discussed this before, and there are probably many reasons why women outlive men, but one of the ones that we discussed was that um, women are forthcoming when it comes to going to the doctor and going to hospital. They are more attentive to their health and more concerned. Maybe they're not, but they go to the doctor more than men do. Men tend to not go as much. They lie when they go, and so that's the problem.
That's part of the problem. You're right. Absolutely. Any other comments about this? Dr. Perez, any comment?
I was going to say so much of what we talk about is that nurturing that are given to girls that are not given to boys. There was a couple studies that showed that cross-dressing, like if you took an infant child and you dressed them like a girl, that the people who cared for them didn't know their sex. This is short periods of time, not days, where they could see their genitalia. But girls were comforted. Their cries, their fidgeting was comforted when they were dressed like girls. But if they put them in, blue blankets and stuff like that, they were often their clues, their desire for being picked up was reduced. So the same people treated, if they knew they had a girl, they were more comforting to that girl than they were to the boy. And we believe that many of these things lead to then males not nurturing themselves, which might be a reason why they don't go to the doctor, or they lie when they go to the doctor, or different things like that. So how we raise children in from a societal standpoint based upon their gender. Now, in this, over the last, let's say, 20 years, 2 decades, with the fluidity of socializing gender response, I wonder what impact that's going to have on the research.
Well, I think there haven't been any studies that have demonstrated the real answer, although the hormonal differences between estrogen and testosterone may well be the most easy to address. But anyway, the answer still is not clear. But much of the evidence relates to the hormonal differences. And so we need to have more studies that address the issues that you bring up. And I think there's a paucity of studies that have done that for the long term.
And I guess in this climate, the fear of us being cut off from research, the fact that Columbia will change their policy and not protect their students because they're concerned about their federal research grants can only tell us that we're moving in the wrong direction.
We all know that anyway. So I mean, it's you know, we're moving from truth to the lie, so that the lie becomes the truth, and the truth becomes the lie. So yeah. So anyway, that doesn't answer the question about why women live longer than men, although it gives us food for thought. Any other comments before we move to the next article?
Women are God's favorites.
Okay. Well, we know that we know who ate the apple. So, and we know who God found was responsible for it. So
We found out that
that was Eve. So, okay, moving on. Scientists make life-changing discovery of a protein link with Parkinson's, which may develop the possibility of getting new drugs to treat Parkinson's disease. And so this is a promissory note that may be helpful, maybe not. Over time, it may be something that will be helpful. Right now, Parkinson's disease is still one of the common neurological conditions that there is no cure for. And so uh, the only way we can go from here is up. So this is a promissory note that perhaps finding out that there is a protein that's associated with Parkinson's may well be the beginning of research that will allow us to have a treatment for Parkinson's disease that is curative. I don't know how many of you have experienced patients with Parkinson's disease, but it is a neurological disease that we treat, but we don't really have a cure for.
It's a devastating disease.
Was there a comment? The question or comment? Dr. President, oh, okay. No comments. Okay. Well,
No,
time will
I
tell.
was just speaking about how devastating it is. My oldest friend has Parkinson's, and uh, it's devastating.
Right. It's devastating to them and it's devastating to watch them.
Yes.
Yeah. Right. Okay. Let's move on to the next one. Well, cataracts is something that it seems as though probably 50 to 60% of the aging population has cataracts. And one thing that is good about cataracts is that their surgery is curative, and that once the lens that is opacified is removed and replaced by transparent uh, particles, the you're able to see again. And so this is one of the miracles, and then of course the uh, fact that probably 50% of people over 60 have cataract surgery, successful cataract surgery, is something that results from the clear lens inside your eye that is no longer clear. And so you see halos, you see colors, and eventually you don't aren't able to see at all. And so the beauty of this is that eye surgery done under local actually can you can get the cataract removed and replaced by a transparent lens that allows you to see again. And so this is something that is often diagnosed if you go see your eye doctor once a year or every 2 years, then they're able to detect the point at which the opacification of the lens occurs and when you need to have your cataract replaced with a clear lens. But one of the things about it is that it does restore the quality of life. Betty Blaylock?
Yes, my eye doctor has diagnosed me with cataracts. At first, I thought he said glaucoma, but he here lately he said cataracts. And I go probably twice a year for him to check it. And the last time I went, he said it hasn't been that much movement. So he doesn't see a real reason to do the surgery unless I really just want him to. But I did ask him, as I age, is it more of a risk of doing the surgery, or should I go ahead and have it done now? And he said, no, he's done cataract surgery on people 99. So I'm confident that once I feel like I really need it, he'll be able to do the surgery.
Sounds like good advice. Okay, Jacobet.
Yes, sir. Thank you. Good morning, everybody. I just had cataract surgery in both eyes, and I tell you, I'm a real stickler for things being different when they say I need to have this or that or the other, and the treatment is this, or you may not be able to do that. Well, I went for a while saying that I don't see anything wrong with my vision, except that I'm nearsighted. And but I tell you, post cataract surgery is the most beautiful revelation I've ever had in my life. Uh, Colors are so vivid, and I still need to have uh, close-up glasses just to help me to read a little better, a little faster. But I am really doing well, and the recovery period is just astronomical. And if the doctor says you've gotten to the point where you need to have cataract surgery, please believe the doctor.
Thank you for sharing. Thank you for sharing. Any other comments? Of course, the difference between cataracts and glaucoma is that cataracts are much easier to treat than glaucoma. Uh, John Tatum?
Yeah, Dr. Callender, is it true that you can have cataract surgery and your cataracts can grow back?
Uh, when you say cataract do not go back, what happens is the lens becomes opacified, but it is unusual for the replaced lens to become opacified. It's unusual. Let's put it that way. Okay. Doc, Dr. Perez, you had your hand up, or
I had retinal surgery, a miracle that happened during COVID when my daughter noticed that I was having a real problem reading and that a part of my retina had actually come off. And so after the surgery, I knew that I would get a cataract. They estimated within 6 months. And then so I had the replace lens again, like Sister Jacobet said, it was a phenomenal. I mean, it's like, da da, you can see again. You didn't even realize what you couldn't see. Um, and my replaced lens after 2, 3 years also became opacified. And I went for a little laser cut, and again, it was a phenomenal response.
well, she answered your question, Tatum, that she had in a situation which her lens, after it was replaced, opacified again. So
Okay.
it can occur. It's not very common, but it does occur.
Mhm.
Uh, any other uh, questions or comments about cataracts, which is, I think, the comments have made it clear the benefit of it and how it differs from glaucoma, which requires more treatment, a different kind of treatment. Okay, let's go on to the next one, next article. This is interesting because they are doing now visual sensitivity tests that predict dementia up to 12 years before it was diagnosed. My only comment is, why would you want to know that you're going to get dementia in 12 years if we don't have a treatment for it, which we don't. And so uh, a lot of the value of identifying a disease become more important if we have a therapy that treats it. And it's possible that within 10 to 15 years, we may have a treatment for dementia. We're still wrestling with a number of different treatments, none of which are curative. And so it may be of more value as we get closer to having treatment, very much like Parkinson's disease in the sense that we watch the people who have dementia and feel so powerless as they wrestle with the fact that their brains are deteriorating right in front of our eyes, and their ability to communicate with us disappears. And there's not much we can do about it. And so identifying earlier tests for it become even more meritorious when we actually have a treatment for dementia. Any other comments on that? And I think emphasizing the importance of eye checks at least once every 2 years is one of the important lessons we should take home from this. Any other comments about dementia and diagnosing it early and the fact that we still don't have a cure for it?
I have a question.
Yes, Dr. Duncan?
Is dementia hereditary or genetic in any way?
Well, it's interesting because there are a number of types of dementia. Alzheimer's is thought to be associated with hereditary involvement, and there's some types of dementia that are just related to aging and the lack of blood circulating to the brain. So there's about 4 or 5 different types of dementia. The commonest one is the Alzheimer's dementia, which there is an genetic association with Alzheimer's.
Okay, that answers my question. I'm the eldest of 6, 7, and my mom's 94, and she was diagnosed with Alzheimer's, I want to say 8 years ago, and now she's in the secondary stages of dementia.
Well, they do have a genetic test that identifies those who are more likely to be associated with dementia, but and exercising uh, is a way to try to decrease the likelihood of dementia, even if you have the genetic predisposition to dementia.
And so there is a
Somebody else had their hand up.
Thank you.
Sorry? Oh, okay. Somebody else had their hand up, I thought.
My comment was
Go ahead.
that the political one, we know that there is a cure for sickle cell as it relates to genes and gene therapy, but we will not spend the money that it would occur. So it's not only having an answer to, but the will to, and to make it available to everybody.
Thank you for sharing. Uh, let's move to the next article. This is an article that parents have probably been aware for some time that limiting daily TV time is healthy, and this is a reason why uh, some people are saying that you might decrease your TV time because it reduces the risk for arteriosclerotic heart disease, and as we know, uh, cardiovascular disease is the number one killer in the United States and the world. And so that if watching TV for 1 hour or less per day was linked to lower heart disease, then it's something worthy of doing. We know, as it was mentioned, there is a genetic risk associated with heart disease, as there is to dementia. And so many, one of the things that epigenetics is all about is recognizing that the things we eat, the exercises we do, uh, overcome very often the genetic predispositions to some of these diseases. So, uh, one of the additional ways that we're now identifying is that watching TV is also increases your risk for heart disease. First, Mr. Tatum, and then Darrell Armstead.
Yes, it's a shame about this because the movies, all the movies are 2.5 hours, 2 hours, 2.5 hours to sit down and watch a movie.
At least 2.5 hours. That's right. That's right. Okay, Darrell.
Yeah, I would think that the time spent watching a computer is about the same time is about the same effect as watching TV.
Good point. And it's interesting that nobody has written a paper about that, but that's interesting observation. Thanks for sharing. John Buchanan?
Yes, I think we talked about this also before. You know, when you're watching TV, you're sitting, and they said that sitting is the new smoking.
Right.
So, I mean, one thing you can do if you're, on the computer or watching TV is get up, watch it standing up.
Right. Just
That'll
like spending the hour with us, changing position is a good idea as well. Darrell?
Yeah, the other thing, I'm not sure if time spent looking at your smartphone could be considered the same thing because you are sitting. And I noticed that where places where people sit, doctor's office, airports, everybody's got their cell phone out. If you're sit, the default is to pull out your smartphone.
Well, they do that while walking, while doing everything.
yeah,
So,
I
I mean,
saw
it's dangerous because they get hit by cars because but they do it in all positions, sitting, standing, lying, whatever. Uh,
I saw a street corner at a stoplight, and 10 people were standing there, and 10 people were on the cell phone.
that's
Nobody
right.
talking to each
That's
other.
right. And they're
Well,
crossing the street, they're still looking on the cell phone. It's dangerous. That's for sure. Okay, let's move on to the next article. Uh, this is an interesting concept of water workouts uh, for adults with overweight or obese and don't want to exercise in other ways. Water exercise is good exercise, as actually John Buchanan has demonstrated time and time again. So whether you swim or exercise in water, the water aerobics is water yoga, jogging, and all of that is positive. I don't know any of you who do it other than uh, John Buchanan, but this is the way to do it if you have difficulty doing it out of water. Any comments about this concept of water aerobics and water Zumba, water yoga, and aqua robotics. And the same exercise duration is suggested.
Yeah, I'm a swimmer nowadays. Even though I was afraid of water my whole life, I swim over 3.5 miles a week. But I remember I used to laugh at the aerobics people because it didn't look like they were doing anything. Then on my honeymoon, I tried water aerobics. It is a good workout. I mean, we were sweating in the water, sweating. It's really good. I mean, it it it's really good. I recommend it highly.
Oh, thank you. Betty Blaylock.
Yes, back in 2012, I think, when I first started having problems with my sciatic nerve in my back, my niece told me, well, come on, Aunt Betty, and go take some water aerobics with me, and maybe that'll help you. And I agree with what John Buchanan just said, that it's not only is it amazing, it's fun to do. And so I did it for a while. It might have helped my back a little bit, but I eventually did have to have back surgery. But the water aerobics was a good thing. So
Okay, any other comments? If not, we'll move to the next article. This is a glucagon GLP-1 we've talked about for quite a while, which is probably the new wonder drug of 2020. And one of the problems that occurred is that because of the shortage of the drug, the fact that it was used for diabetics and then it was used for obesity, and it was a shortage, the compounding of the GLP was an issue. And the compounding of the issue was associated with many side effects of the use of the drug. And so now we got to the point where we got enough of the GLP-1 drugs and we don't need to compound it any longer. And we think that this is a great way of overcoming the side effects and toxicities that were associated with the compounding of GLP-1s and people taking the wrong doses of GLP-1. So we think that this is a way of decreasing the side effects. I don't know, I mean, if any of you have had an opportunity to use any of the GLP medications and whether they were covered or not. But this is something that is no longer the case since the GLP-1 drugs are FDA, for the most part, FDA approved and now available. Anybody been on GLP-1s? I think John, you have a comment.
My question is, what does compounding mean?
It meant that, okay, in other words, they didn't have the right dosage. So they got the compounds which were not pure and they use them. They are no longer available now. So it's not an issue. The compound means that they had all kinds of, they would dispense the drugs uh, at different doses. And that no longer is the case. Now you get the drug at the appropriate dosage, you take it accordingly, and you don't have to figure out how much you ought to take. So that's what compound mean, that they would give out the compound and you'd have to uh, decide how much to take. That no longer is the case. For the most part, you should take it according to what your doctor tells you to take.
I wanted to ask a question. Is one of the drugs Ozempic?
Yes. Okay, any other questions about it? Next,
One other comment. My daughter has type 1 diabetes, and normally you think of Ozempic for type 2, but she's taking Ozempic and she said it's working for her. So, you leave it well enough alone.
that's right. Good idea. We're finding out so many different benefits of the GLP-1 drugs. Uh, Now, this article is talking about the fact that most of the time the drug is used for 1 or 2 years and then stopped. So, what happens after that? Uh, Many of the studies suggest that after taking it for 2 years, that most of these people will regain their weight back. Now, that is the obesity aspect of it. However, the diabetic aspect, because that is also the treatment for diabetes. And as we know, there's about 5 or 6 other disease entities for which it is treatment. So the question is, what is the long-term effect of GLP-1 drugs on these diseases? And we we haven't been using the drugs long enough to answer the question for 5 years. So we have to do much more research and get some of these answers to the question. But for obesity, we do know that after 2 years, uh, the people often regain some of the weight they lost. Okay, Betty.
Yes. Did you say that they normally stop taking them after 2 years? Is there a reason for
Yes, that's correct. Most people do.
there's no reason for it. They just decide to stop, or is it
Yeah,
a different reason?
I imagine so. Although I would say to you, we don't have any long-term studies on GLP-1 drugs after 2 years.
Oh, okay.
But
Okay.
most of the people who take it for obesity, we're talking about,
Okay.
stop after 2 years
Oh, okay. Okay.
and they start to regain their weight again. So the question is, should they restart it or what are the advantages, disadvantages? And that has not been addressed yet. And we all know that obesity is not a quick fix disease, unless you have bariatric surgery, in which case it's long lasting. But with GLP-1, it's not long lasting. This is an article that says that in women with Ozempic and other GLP, that you may have hair loss. And this is probably more important for women than with men. And the incidence is not clear, but it is suggestive that there is hair loss. And over time, I think we'll be able to identify what percentage of people will actually lose their hair. This is a new finding, and over time, we will have more information on it. A lot of people feel that the main reason for this hair loss may be related to uh, nutrition, but we really don't know yet. Um, I think time will tell, but and some have not clear on whether the weight hair loss is related to the nutrition or whether it's related to the weight loss itself. So we're going to have to do many more studies to get some answers to this question. One thing that you can do is to try to, as we've mentioned with the GLP-1 drugs, is that proper nutrition and using appropriate vitamin supplements may be the way to prevent it. Of course, we aren't positive about it, but I think more research will tell. Of course, we mentioned before that more fruits and vegetables and focusing on all elements that are part of the chemical body should be addressed. But the specific answer to that is really not known yet. Any other comments? If not, we'll go to the next article.
Yeah, one comment. I mean, there are so many other reasons for hair loss.
Yeah,
I think that age plays a role. Like if you're in your 30s, 20s or 30s, and you're having hair loss.
well, I think they're more concerned about it in women. In males, as you said, that's the case. But, let's go to the next article. I think this article is trying to emphasize that obesity is not just one word thing, but that it's related to many factors. One of the alarming things about obesity is that there are many people who don't eat very much who are obese, and there are many people who eat very much and they are obese. So why is it that the person who doesn't eat so much becomes obese? And we say that it's related to your metabolic rate, basal metabolic rate. And some people uh, consume uh, small amounts of food and the body doesn't burn it up quickly. And some people it burns it up very quickly, and so they don't gain weight. And others it's very slow. And then there's so many other aspects of obesity because we consider a disease that is an inflammatory disease. And as such, it's not just about what you eat and what you drink. Uh, so that we say there's uh, no cure necessitating lifelong management. But of course, bariatric surgery has become closest to recur. But so far, the best treatment is uh, bariatric surgery, the long-term treatment, right? And you see that this 70% of patients discontinue use within 2 years. And they believe when they stop that they're going to stay at their weight. And the problem is that they regain the weight. Any comments on this article? If not, we'll move to the next article. And seems like we're stuck on obesity, but it's a good reason. 50% of Americans are overweight, and it's unhealthy to be overweight, and obesity requires treatment. And so hence uh, so many articles on obesity and emphasizing that it's an inflammatory disease, it's chronic. It's not something that you uh, can fix in a week or so. And so we have to recognize that it's a chronic illness and treat it as such. Also, one of the most important things to do is to destigmatize obesity. Dr. Perez.
And on that point, destigmatize, I'm looking at some of the direct to consumer advertising around GLP-1s, and it's reminiscent of what we did with HIV infection, almost believing that when you could detect it, that many people that I worked with thought that they had a green light to engage in sexual behavior that put them at risk. So I wonder, um, as we were moving closer to the recognition of obesity as a disease, has some of the advertising for GLP-1s as the wonder drug for this changed our opinion about obesity so that it's something that you can take care of with a quick fix?
It's interesting that we now have more actors and actresses and in advertisements people who are uh, generously who are either overweight or obese, and that was never the case in the past. So it seems as though we are accepting uh, obesity and being overweight as it being okay, when in point of fact it is unhealthy.
A
Uh,
disease condition in and of itself.
right, it is. And I think this article is trying to get the doctors to recognize it as a disease entity, and not that's why the destigmatization of the uh, overweight and obesity becomes important, as well as doing the things that are necessary to improve your health. Uh, it's clear that the physical activity that 30 minutes a day for 150 minutes of meat per week is important to uh, stay healthy, whether you're overweight or not. Any other comment on this? Oh, D Daryl and then John Buchanan.
Okay, I'm going to go out on a limb here. I just hope some researchers are watching. Okay, we're mammals, but we weren't always mammals. All life on Earth came out of the sea initially when it was cold blooded, like fish and reptiles. Being warm blooded is an adaptation designed to uh, basically fight fungal infections. That's the primary bane of being a cold blooded animal, fungal infections. Being a mammal, mammals have higher metabolic rates than cold blooded animals, which means that to satisfy that metabolic rate to produce body heat, we have to be voracious eaters compared to cold-blooded animals. Um, we do that, and in combination with our gut flora to uh, to consume all of that and produce heat. Uh, but if we did it to combat fungal infections, one of the things that obese people have a great tendency to have, especially those that don't eat a lot and stay obese, they have a lot of candida, fungal infections in their guts, and that's been known to, studies with candida in other mammals such as mice. Uh, Candida induces obesity in mice, and so there may be a correlation. Um, you look at the obese. There's a couple of factors. You could have a factor like candida that that can induce obesity, or you could have a wrong diet, a high fat, high calorie diet that can induce obesity. But I know they're looking for GLP-1 receptors as one a way of fighting it, but another possible way of fighting it may be fighting the fungal infections in their gut flora.
Okay, thank you for sharing. John Buchanan?
Yes, we have a tendency to glorify some traits. And if you look at the rappers, the music industry, Funky Fats and Heavy D, uh, all these artists now, it's almost like normalized to be big and fat, and uh, and they're superstars. So that makes it okay to be overweight, and I think it's very unhealthy.
And they die early. So I think that we're barking up the wrong tree with that false uh, statement. Any other comments before we move to another article? And all we're saying is that obesity has its downfall, and it's unhealthy. So we can't hide that. And that when you have obesity and high stress levels, as we have, then cancer and other diseases are commoner. So uh, you remember the time 2 meetings ago we talked about how stress is related to so many diseases now, especially in cancer. So the combination of obesity and stress uh, predisposes one even more so to cancer. And so this is something to be concerned about, whether it's primary cause of pancreatic cancer, which is one of the deadliest cancers in the world. I'm not sure about, but certainly uh, stress and obesity is a combination that is very much undesirable. And this is a maintaining a healthy diet and eating in moderation, as well as exercising, is good for overall health. Cancers, of course, included. Any other comments? If not, we'll go on to the next article. This is an article that says something that we've recognized time and time again, that sugar sweetened beverages are linked to higher oral cancer risks in women. Uh, and we know that HPV is linked to higher oral cancer rate in men. And so this is not new to us, as we've discussed this many times, that the two of the biggest poisons that we eat are salt and sugar. And this just addresses the salt part of it. Which is worse, sugar, salt, or smoking, or alcohol? All have their role in getting us out of this earth. Any other comments about this before we move to the next article?
Yeah, we can
Okay, Tatum.
put artificial sweeteners on the list. You know, have a list of salt and sugar.
Right. Well, this article is on sugar.
Right. Well, I'm talking about artificial sugars.
What about it?
It should be on the list that's bad for you.
Well, well, they did not include that in this article. That's all I'll say.
We've said it before on this
I'm
call.
sorry?
We've said it before on
Many times, you're right.
about artificial sweetener.
Well, we've also identified that artificial sweeteners decrease the likelihood of hyperglycemia. And so that there's some people for whom artificial sweetness is important, but they carry their own risks. Janice?
Yes, I was looking at this article last night and quickly looking at it. I thought it was related to artificial sweeteners. And of course, many times you've said artificial sweeteners are bad for you. If you want sugar, use sugar. Um, I'm a coffee drinker and I'm hooked on Splenda. I use artificial sweetener and I continue to use it even after you said it was bad for you. But I thought in this article it was related to artificial sweeteners being bad and causing oral cancer. Well, I had my coffee today with regular sugar. Now the
Well,
sugar's bad for you.
but this article is on sugar,
Right,
not on
right.
artificial sweetness.
Mm-hmm.
Right.
So it's artificial and sugar.
This article is on sugars,
Yes.
sugar sweet. So
Mm-hmm.
that would be different.
Okay. Yeah, I
Right.
know you've also said in the past, if you're going to have the artificial, you may as well have the sugar.
No,
So,
I've never said that. That's what some of the articles said.
okay,
I do not agree.
okay.
They're
So both are
diabetics
bad
who
for you,
need
in
to
other
take
words.
artificial sugars
Yeah,
rather than sugar.
yeah. Both are
So
bad for you.
artificial sweetening,
The
just
artificial.
like uh, there's good evidence that uh, salt substitutes improve the management of hypertension,
Mm-hmm.
so that you should eliminate salt and take salt substitutes. So that I'm not one of those who's in favor of not taking artificial sweeteners, nor am I in favor of those who think you
Take
should
sugar.
take salt substitutes. Now, there are articles that will address that, but I'm
Mm-hmm.
not one of those who's in favor of that. Darryl?
Yeah. Uh, if you want a sweetener substitute, uh, I'd say fruit. The whole fruit, and nothing but the fruit. Uh, because
Thank you. Thank you.
yeah, whole fruit does have fiber in it, which slows down the body's metabolism of the sugar, and
Mm-hmm.
so it makes it safe as opposed to like you got table sugar. There's no fiber in it, and you're just going to get a straight shot, and your body's going to react to it chemically different than say the fruit that you get in sugar. I'm sorry, the sugar that you get in fruit.
Fructose.
Thank you for sharing that because that's important. Okay. Any other comments?
What about honey?
Yes, Betty.
What about honey
What about honey? I mean, what do you
as a
mean?
substitute for sugar?
Oh, Dal, you have any comments on that? I don't have any comment
Yeah,
on
there's no fiber. There's nothing to slow down the sugar rush. So yeah, I mean, if your sugar is something that should be used sparingly, whether it's table sugar, beet or cane sugar or honey, shouldn't use a lot of it. I'm not sure what the guidelines are, but I don't use any. There's agave that has that has very little fiber in it either. You can get raw agave, which increases the sugar. I mean, it increases the fiber just a little bit, but they say that you can put honey on a wound and it'll heal better. It's got some additional properties, um, but uh, if you're going to use like honey to people put in way too much sweetener if it's honey, if it's sugar, if it's agave to sweeten their coffee. um, so from that standpoint, I wouldn't recommend it.
Well, what fruit would you put in coffee?
that.
Tea
Well,
or
I used to drink coffee. I used to drink it black without any sweetener. You say you're hooked on sweetener, but if you do coffee for 3 weeks without any sweetener, you'll like it.
I don't do coffee, so I wouldn't like it. And I doubt tea. I'm a tea drinker, but I don't think I drink tea without some type of sweetener.
Yeah, I drink black tea a couple times a week with no sweetener. You get used to it.
Mm.
It's 10:30 now, so I think we'll
Yeah,
have to
okay.
close with this discussion.
Yeah.
So thank you all for attending today. We've had a great session again, and thank you for all of the great comments as we all learn together how to eat and exercise and see another day. Any closing comments by anybody? We haven't heard from Elizabeth today. This must be a record. We haven't heard from Elizabeth today.
Good to see Joyce
And
Armu.
we had Dr. Duncan today, so we're so happy to have her. Let her know that we appreciated her being with us. And Joyce Amu, it's good to have you. Constance Williams and everyone. So we had a great session last week, and we learned how important this group is, because it looks like the churches and groups like this will be ways in which we can help our communities fight off the onslaught that is that we're associated with. So look forward to seeing you again next week. God be with all of you.
Thank you.
I'll see you at Woodbury.
Thank you.
Thank you
Thank
so
you.
much. Bye.